Hello everyone, welcome back to my YouTube channel. Today I am going to discuss about the external carotid artery. Here from this video you will learn about the cause of the external carotid artery, the branches as well as the relations of the external carotid artery. In this picture you can see the neck region and the face, the mandible, and here the vertebrae are present, and here the cartilages, thyroid cartilage, and here mastoid process, and external uh, acoustic meatus, and the mandible is there, and also the masseter muscle. You can see the cut section of the internal jugular vein as well. Here the internal jugular vein. Here this is the common carotid artery. Common carotid artery. You can see the bifurcation of the common carotid artery here. So it divides into internal carotid artery and external carotid artery. Common carotid artery comes and ascends upward, and it divides into two branches as internal carotid artery and external carotid artery. So the level of bifurcation is the upper border of the thyroid cartilage. This is the thyroid cartilage. So you can see it has divided into two branches as internal carotid artery and external carotid artery at the level of upper border of the thyroid cartilage. You can see a carotid sinus in the bifurcation of the common carotid artery as well. So here we will discuss only the anatomy of the external carotid artery. When we talk about the external carotid artery, it supplies structures in the neck, face and scalp. It also supplies the tongue and the maxilla. You can see the branches coming from the external carotid artery distributes towards the neck region, the face, the scalp as well as the tongue and the maxilla. So I told you earlier as well, the external carotid artery originates at the level of upper border of the thyroid cartilage, and it terminates in the substance of the parotid gland here. You cannot see the parotid gland here, but this is the area where parotid gland is located. So this external carotid artery terminates at the level of parotid gland or in the substance of parotid gland behind the neck of the mandible. You can see this is the mandible. It ends behind the neck of the mandible by dividing into superficial temporal artery here and the maxillary artery here. So what are the two terminal branches of the external carotid artery? They are superficial temporal artery and the maxillary artery. Where it terminates in the substance of parotid gland behind the neck of the mandible. Here in this picture you cannot see the sternocleidomastoid muscle. You know, sternocleidomastoid muscle attached to the mastoid process as well as the sternum and the clavicle. So it goes like this. So close to the origin of the external carotid artery, the artery emerge from the undercover of the sternocleidomastoid muscle. You can feel the pulsations of the external carotid artery at the upper border of the sternocleidomastoid muscle as well. So again, what are the places that external carotid artery begins and terminates? It begins at the upper border of the thyroid cartilage and it terminates in the substance of parotid gland behind the neck of the mandible. So what are the terminal branches of the external carotid artery? They are superficial temporal artery and the maxillary artery. So when we talk about the relations of the carotid arteries, so external carotid artery first lies medial to the internal carotid artery. Here I don't know whether you can see it clearly. Here the external carotid artery first lies medial to the internal carotid artery. This is the internal carotid artery. This is the external carotid artery. First, external carotid artery lies medial to the internal carotid artery. As the external carotid artery ascends in the neck further upwards, it passes backwards and lateral to the internal carotid artery. You cannot see the exact course here, but you have to remember that first the external carotid artery lies medial to the internal carotid artery. Then when it further ascends upward in the neck, it passes backward and lateral to the internal carotid artery. External carotid artery also crossed by posterior belly of digastric and stylohyoid muscles as well. Here in this picture also you can see the external carotid artery here, the bifurcation of the common carotid artery here, and the internal carotid artery here. So this is the cut section of the sternocleidomastoid muscle. You can imagine that this muscle goes like this and attach here like this. So when we talk about the relations of the external carotid artery, anterolaterally the artery is overlapped by its beginning by the anterior border of the sternocleidomastoid. This anterior border of the sternocleidomastoid is overlapped at the external carotid artery at its beginning or at its starting point, like here. This margin overlap here. And above this level, the artery is superficial. That means here there is a triangle or intermuscular space. In this space, the artery is superficial. That means it is only covered by skin and the superficial fascia. And then it is crossed by hypoglossal nerve. You can see this is the hypoglossal nerve or 12th cranial nerve. Hypoglossal nerve. It is crossed by the hypoglossal nerve, posterior belly of the digastric muscle as well as the stylohyoid muscle. You cannot see the posterior belly of digastric here. You can see the stylohyoid muscle. And what are the structures that is crossed by? Are the hypoglossal nerve. Here the hypoglossal nerve. Then the posterior belly of digastric and the stylohyoid muscle. This is the stylohyoid muscle. And within the parotid gland, when we talk about the artery within the parotid gland, here in this area the parotid gland is located. And within the parotid gland, it is crossed by the facial nerve. When we talk about the relation of the internal jugular vein to the external carotid artery, internal jugular vein first lies lateral to the artery and then it is posterior to it. Here, internal jugular vein first lies lateral to the external carotid artery and then it is posterior to the external carotid artery when it is ascend upward. So the medial relations are the wall of the pharynx and internal carotid artery. This is the internal carotid artery, so it becomes a medial relation with the wall of the pharynx. Then stylopharyngeus muscle, glossopharyngeal nerve, and the pharyngeal branch of the vagus nerve pass between external and internal carotid arteries. Stylopharyngeus muscle, then glossopharyngeal nerve and the pharyngeal branch of the vagus nerve. They pass between external and internal carotid arteries. Look this picture. This is the glossopharyngeal nerve or 9th cranial nerve. This is the pharyngeal branch of the vagus nerve. You can see they crosses in between the external carotid artery and the internal carotid artery. Here in this picture also you cannot see the stylopharyngeus muscle, but imagine the stylopharyngeus muscle also goes like this in between external carotid artery and the internal carotid artery. So what are the medial relations of the external carotid artery? They are posterior wall of the the wall of the pharynx, then internal carotid artery, then the stylopharyngeus muscle, glossopharyngeal nerve, and the pharyngeal branch of the vagus nerve pass in between external and internal carotid arteries. Let's discuss about the branches of the external carotid artery. The branches of the external carotid artery are superior thyroid artery. This is the superior thyroid artery. Ascending pharyngeal artery. This is the ascending pharyngeal artery. Then the lingual artery. This is the lingual artery. Then facial artery. This one is the facial artery. Then occipital artery. This one is the occipital artery. Posterior auricular artery. This one is the posterior auricular artery. Then you have the superficial temporal artery here and the maxillary artery here. Altogether there are 8 branches. What are they? They are superior thyroid artery, ascending pharyngeal artery, lingual artery, facial artery, occipital artery, posterior auricular artery, superficial temporal artery, and finally maxillary artery. Let's have a look on the cause of each of the branches. When we talk about the superior thyroid artery, this is the superior thyroid artery. Superior thyroid artery curves downward to the upper pole of the thyroid gland, and it is accompanied by the external laryngeal nerve as well, and it supplies cricothyroid muscle and the thyroid gland. Here you can see the superior thyroid artery goes into the substance of the thyroid gland, and it anastomoses with the inferior thyroid artery. This is the superior thyroid artery. Next branch is the ascending pharyngeal artery. This one is the ascending pharyngeal artery. As you can see here, it ascends along and supplies the pharyngeal wall. It supplies to the pharyngeal wall. Then this is the lingual artery. It loops upward and forward. It loops upward and forward, and it supplies the tongue. As the name implies, it supplies the tongue. Then the facial artery. This one is the facial artery. You can see a tortuous course of the facial artery as well. The artery loops upward close to the outer surface of the pharynx and the tonsils. First, it lies deep to the submandibular gland. Here in this area there is submandibular gland. Then it lies deep to the submandibular gland and emerges and bend around the lower border of the mandible by coming from the superior aspect of the submandibular gland. So the facial artery is a relation to the submandibular gland superiorly. Then the facial artery hooks at the lower border of the mandible. Then it ascends over the face close to the anterior border of the masseter muscle. You have the masseter muscle here in this area. You can see the course of the facial artery here from this picture. You can see it hooks from the lower border of the mandible anterior to the masseter muscle. This is the masseter muscle. Then facial artery ascends further upwards around the lateral margin of the mouth, and it terminates at the medial angle of the eye by anastomosing with the branches of the supratrochlear and supraorbital arteries. Branches of the facial artery supplies tonsil, submandibular salivary gland, and the muscles and the skin of the face. When we talk about the occipital artery, you can see the occipital artery here, the course of the occipital artery. As you can see here, it goes towards the occipital lobe. Here, it supplies back of the scalp. Then the posterior auricular artery, this one is the posterior auricular artery. It supplies the auricle and the scalp. Then the terminal branches are superficial temporal artery and the maxillary artery. Superficial temporal artery ascends over the zygomatic arch. This is the zygomatic arch. It ascends over the zygomatic arch, and you can feel the pulsations in front of the auricle as well. Feel the pulsations in front of your auricle. You can feel it clearly. Then it accompanied by auriculotemporal nerve and supplies the temporal region of the scalp. Then you have the maxillary artery. Maxillary artery runs forward and medial to the neck of the mandible. Here you can see this is the mandible and this is the neck area, and it enters the pterygopalatine fossa here. I will discuss the cause of the maxillary artery in a separate video. So if you gain some knowledge regarding this external carotid artery, please subscribe into my channel and put a like and comment in a comment section. Thank you for watching.